Taking one more breath beside you.
There is a shame factor in our society surrounding miscarriage and infant loss. And the first reframe I do for a client is to just acknowledge that any of those feelings are clear examples of a mother's love. That there is not, if anything ever happens to your baby, the first thing we do is blame ourselves. Oh, they skinned their knee. I should have been watching them. Oh, they dropped their books. I shouldn't have, I should have helped them. I should have done this. And that's a good thing. It's actually a really, there's a part of motherhood that comes with some of that safety anxiety that keeps us safe. It keeps us on it. But then beyond that, it is not helpful and not healing, And so first, normalizing that that's not a wrong thing to feel. It's kind of built into the role, but it doesn't make it true. And so the next step is to kind of unravel that feeling that you can feel all sorts of things, and it doesn't mean that it's true. And so what do we know to be true? What don't we know? And most things surrounding a story of pregnancy loss, there's a lot of unknowns most of the time. There's most often not anything to blame, which can be really frustrating. And if there is someone or some action that went awry, just empowering the mother that in those moments of crisis, she did everything a loving mother would have done to protect her child. And we all rely on each other and our intuition and the experts we've chosen, like the doctors we see, again, beyond that, we're scrambling for making sense of something that is not going to make sense. So it's an uncomfortable place to land, but it helps release the burden of responsibility, because they were responsible for that baby, and they did everything they were supposed to do and took incredible care. And sometimes that doesn't result in the outcome we had hoped for.